Did you know that there are medications prescribed for dementia that can actually help with symptoms, but many people don't know how they work or what they do? Dementia can be a scary word, especially as we age, but it doesn't always mean the end of independence. And while there's no cure, there are treatments that can slow its progression and improve quality of life. But do these medications really work? And more importantly, which ones should you know about? If you or someone you love is dealing with dementia, keep watching, because the answers might surprise you. If you're over 60, it's important to stay on top of your health and to make the most of every day. If dementia or memory problems are on your mind, you're not alone. According to the Alzheimer's Association, around 1 in 9 older adults experiences some form of dementia. But while that may sound alarming, the good news is that there are medications that can help. Today we're diving into those meds. What do they do? Who should take them? And how can they help you or a loved one keep their mind sharp? But before we get into the specifics, a quick note. This video is all about proven, real medications. We're not talking about fads or quick fixes, just what the science says works. If that sounds helpful, consider subscribing to stay updated on more health tips every week. Let's start by tackling a big question. What do these dementia medications actually do? You've probably heard about drugs like donepezil and Memantine being used for dementia. But how do they work? And are they actually effective? Well, medications for dementia focus on managing symptoms and slowing down the progression of the disease. They don't cure dementia, but they can help people maintain their cognitive function and quality of life for a longer time. Let's break down some of the most common options. First up, donepezil. It's the most commonly prescribed medication for Alzheimer's disease, and it's been around since the mid-90s. Donepezil works by increasing levels of a neurotransmitter called acetylcholine in the brain. Acetylcholine helps with memory and learning, and in people with dementia, these levels tend to decrease, leading to symptoms like memory loss and confusion. Think of it like turning the volume up on a radio. If you can increase the signal, in this case the acetylcholine, you help your brain communicate better, even if it's not perfect. It doesn't stop the disease, but it can delay the symptoms for a while. It's typically prescribed to people in the early to moderate stages of Alzheimer's, and sometimes for other forms of dementia, like Lewy body dementia. You might be wondering, does it work for everyone? Well, not exactly. While it works for many, it doesn't seem to help every individual, and some people experience mild side effects, such as nausea or diarrhea. It's not a miracle cure, but for many it can make a real difference. Next, we have Memantine. This medication works a bit differently. It's often used in the later stages of Alzheimer's to help manage symptoms. Memantine regulates glutamate, another neurotransmitter involved in learning and memory. When there's too much glutamate in the brain, it can cause brain cells to become overstimulated and even die. Memantine helps keep that in check. Memantine is often prescribed on its own or combined with donepezil. While it doesn't reverse dementia or stop the brain changes, it may help slow the rate of cognitive decline, especially for those in the more advanced stages of Alzheimer's. Some people find it particularly useful for managing things like agitation or aggression, symptoms that can make life harder for both the person with dementia and their loved ones. Mid-insight number 1. So, does that mean these medications are all you need? Not exactly. While they help manage symptoms, they don't fix the root causes of dementia, like brain cell damage or neurodegeneration. That's why medications are typically used alongside other strategies, like lifestyle changes, therapies, and sometimes supplements, which we'll cover in the next part. But here's something that may surprise you. Even though these medications aren't perfect, Recent studies show that early treatment with donepezil or memantine can lead to a better quality of life and slower decline in symptoms. Now, let's dive into a few more important medications that play a role in treating dementia. One of the key players is rivastigmine, which is also a cholinesterase inhibitor, like donepezil. It works by increasing acetylcholine in the brain, helping to improve communication between nerve cells. Rivastigmine is often prescribed when donepezil is not an option or isn't working as well. It's available in both oral and patch forms, so it offers some flexibility depending on what's easier for the patient. For example, the patch can be a great option for someone who has trouble swallowing pills, especially if they experience nausea or other side effects from oral medications. Just like donepezil, rivastigmine can be effective in treating mild to moderate Alzheimer's, but it's not a one-size-fits-all solution. Some patients see improvement, while others experience only modest effects, and side effects like dizziness or headaches can occur. Another medication worth mentioning is galantamine, another cholinesterase inhibitor that works in a similar way to donepezil and rivastigmine. It also helps increase acetylcholine levels in the brain, improving cognitive function. It's commonly prescribed to treat mild to moderate Alzheimer's disease. What's interesting about galantamine is that it works in two ways. Not only does it increase acetylcholine levels, but it also helps the brain respond better to the neurotransmitter. Think of it like giving the brain a little nudge to help it use what it already has more effectively. However, galantamine can cause gastrointestinal issues like nausea and diarrhea, so it's important for patients to work with their doctor to monitor side effects. For some, these side effects are manageable. For others, it might be a deal breaker. Here's something to keep in mind. Although all of these medications, donepezil, rivastigmine, and galantamine, are quite effective in the early stages of dementia, they don't actually stop the disease from progressing. They merely help manage symptoms for a while, potentially slowing the decline of memory and cognition. But here's an important point. Even a small delay in the worsening of symptoms can make a huge difference in someone's quality of life. These medications can help a person stay more independent for longer, keeping their ability to perform daily tasks and maintain social connections. When it comes to dementia, every extra month or year of cognitive function can be a real gift, not just to the person affected, but to their caregivers and loved ones as well. One question that comes up often is, how long do these medications actually work? The answer varies from person to person. Some individuals see noticeable improvements for a year, or even more, while others might only see modest benefit for a few months. The key takeaway is that it's important to regularly check in with your healthcare provider to assess how well the medications are working and whether adjustments need to be made. For people who are on these medications, especially in the early stages of dementia, it's crucial to have a plan in place for regular follow-ups. Dementia can change rapidly, and you want to ensure that the treatment plan evolves alongside the progression of the disease. Let's talk about a common misconception. These medications don't work, so there's no point in taking them. While it's true that these drugs don't cure dementia, research has shown they can make a meaningful difference in the lives of people living with Alzheimer's and other forms of dementia. In fact, studies have demonstrated that these medications can help maintain cognitive function for up to a year or longer. And that can be incredibly valuable for both the person with dementia and their family. For caregivers, these extra months or years of clearer thinking can mean more opportunities for meaningful interaction and independence. One recent study found that individuals who were started on these medications early in the disease showed significantly better outcomes in terms of maintaining their ability to perform daily tasks. They were also less likely to need assistance with basic activities of daily living. These medications are not a cure, but they are a tool. And like any tool, the earlier you start using it, the more effective it can be. There's also a newer option on the horizon that has been getting a lot of attention. Aducanumab, sold under the brand name Aduhelm. This medication was recently approved by the FDA for Alzheimer's disease, but it's different from the others we've discussed. Instead of targeting neurotransmitters like acetylcholine, aducanumab works by targeting amyloid plaques in the brain, abnormal protein deposits that are a hallmark of Alzheimer's disease. The goal is to slow the progression of the disease by removing these plaques. Research on aducanumab is still ongoing, and while the results have been mixed, it's an exciting development in the search for treatments that might slow down, or even stop, the underlying processes of Alzheimer's. However, it's important to note that aducanumab can come with significant side effects, and its long-term effectiveness is still being studied. It's also expensive, so many people will need to work closely with their doctors to determine whether this treatment is a good fit for them. Now that we've covered the most commonly prescribed medications, let's shift gears a little. You've probably heard about non-drug treatments for dementia, which are an important part of the equation. Medications alone won't manage dementia entirely, and other treatments, like therapy, lifestyle changes, and even brain training, are key to improving quality of life. For instance, cognitive behavioral therapy, CBT, and reminiscence therapy can help individuals with dementia maintain mental function and reduce distressing symptoms like depression or anxiety. These therapies focus on improving mood, maintaining communication skills, and encouraging meaningful social interactions. Cognitive exercises and activities that involve memory recall, problem-solving, and social engagement can also help stimulate the brain and slow cognitive decline. While these methods aren't a substitute for medication, they complement treatment and can have a positive impact on a person's daily life. A big question often asked is, can lifestyle changes help with dementia? While there's no magic fix, the answer is yes. Making the right lifestyle choices can certainly help. Research has shown that a healthy diet, regular physical activity, and staying mentally and socially engaged can all play a role in supporting brain health. For example, diets rich in omega-3 fatty acids, antioxidants, and vitamins found in foods like leafy greens, fish, and berries can support cognitive function and reduce inflammation, a factor linked to brain aging. Exercise is another powerful tool. Physical activity improves blood flow to the brain, reduces inflammation, and increases the growth of new brain cells, all of which are beneficial for individuals with dementia. One study even showed that seniors who exercised regularly were able to maintain cognitive abilities longer than those who were sedentary. But here's something to consider. The effects of these medications aren't always immediate. It's important to have patience and stick with the treatment plan. And alongside medications, implementing positive lifestyle changes like eating well, exercising, and keeping your mind active creates a well-rounded approach to dementia care. Together, they can help manage symptoms and improve the overall quality of life. We can't talk about dementia treatments without addressing one of the more controversial options: alternative and complementary therapies like herbal supplements, acupuncture, or special diets. Some people turn to these treatments in the hope of slowing dementia progression or improving symptoms. It's crucial to recognize that while there's often no harm in using these therapies alongside prescribed medications, they are not a substitute for FDA-approved treatments. For instance, supplements like ginkgo biloba and curcumin have been promoted for brain health, but clinical research has shown mixed results. Ginkgo biloba, for example, has been studied extensively, but findings are inconsistent. Some studies suggest a slight benefit in improving memory, while others show no effect. Before trying any alternative therapies, it's always important to talk to your healthcare provider. You want to make sure any new treatment doesn't interfere with your prescribed medications or cause harmful side effects. So, if the medications we've discussed can help manage symptoms, and lifestyle changes can provide additional support. When do we start? And more importantly, when should you talk to a doctor about starting treatment? The earlier you intervene, the better. That's why, if you or a loved one notice signs of cognitive decline, even mild forgetfulness, trouble with concentration, or difficulty with everyday tasks, it's essential to speak with a healthcare provider as soon as possible. Early diagnosis and early treatment give you the best chance to make the most of available treatments and help slow down progression. Your doctor can guide you through the best options, whether that's medication, therapy, or lifestyle changes. And if you're already on medication but are wondering whether it's still effective or if the side effects are outweighing the benefits, don't hesitate to have that conversation with your doctor. A small adjustment, whether it's changing the dosage, switching medications, or adding a new therapy, can often make a huge difference. Let's talk about something many people don't want to face. What happens when medications stop being effective? Unfortunately, that's part of the progression of dementia. Over time, medications may become less effective, and the symptoms may worsen despite the best treatment. But here's the thing, even then, there are still ways to manage. The goal should never be about finding a perfect treatment. It's about improving quality of life. When medications stop being effective, it's important to focus on comfort, maintaining independence for as long as possible, and supporting your loved one with the best care possible. As we approach the conclusion of our discussion on dementia medications, it's important to remember one key truth. There is no one-size-fits-all approach to treating dementia. What works for one person may not work for another. This is why finding the right medication and treatment plan is often a process of trial and error. Doctors will work with you to monitor symptoms, adjust dosages, or even change medications as the disease progresses. The key is communication between you and your doctor, and between caregivers and the rest of the family. Everyone needs to be on the same page, constantly reassessing what works and what doesn't. It's also worth noting that the treatment plan should evolve as the person with dementia moves through different stages. What may help in the early stages might need to be replaced or supplemented with other treatments as the disease advances. A critical point is mental health. Depression, anxiety, and agitation can often accompany dementia, and managing these symptoms is just as important as addressing cognitive decline. Medications like antidepressants and anti-anxiety meds can be part of the treatment regimen, but again, they should be carefully prescribed and monitored by your healthcare team. Many people with dementia experience mood swings, confusion, and even aggression. In these cases, medications like SSRIs or atypical antipsychotics can be useful. But like all medications, they come with risks and side effects, especially for older adults, so they should be used with caution. Another area that's receiving a lot of attention in dementia treatment is supportive care. This involves non-medical interventions designed to improve the person's quality of life. One example is occupational therapy, which helps individuals with dementia maintain daily routines and adapt to the changes in their abilities. For caregivers, education and support are key. It's easy to feel overwhelmed when caring for a loved one with dementia, but having a strong support system can help reduce caregiver stress. Joining a support group, connecting with others who are going through similar experiences, and learning more about dementia can help you feel more empowered and less isolated. Here's a thought that can be easy to overlook. Empowering the person with dementia. Often, families and caregivers focus so much on treatment and management that they forget the importance of maintaining the person's autonomy for as long as possible. Even when cognitive abilities decline, individuals with dementia still need to feel valued, respected, and involved in decisions about their care. Small adjustments, like allowing a loved one to make choices about their day, offering them tasks they can still perform, or encouraging them to engage in activities that bring them joy, can all have a positive impact. This can boost self-esteem and give them a sense of purpose, which is vital to maintaining emotional well-being. So, what does all this mean for you? If you're dealing with dementia, whether personally or as a caregiver, it's essential to remember that medications are only one part of the treatment picture. A comprehensive approach includes medications, lifestyle changes, therapies, and mental health support. It's a journey, and it's okay to feel uncertain at times, but one thing is certain. Even though dementia can be daunting, with the right treatments and support, it's possible to improve quality of life and maintain independence for as long as possible. To wrap up, here are a few key takeaways. Early intervention is crucial. The earlier you start treatment, the better the outcome. Medication helps manage symptoms, but it doesn't stop the disease. Think of it as a tool to slow the decline. Lifestyle changes, like staying active and eating a balanced diet, can complement medication and help maintain brain health. Support for caregivers is just as important as treatment for the person with dementia. Find help, stay informed, and prioritize your well-being. Stay hopeful. Even when medications become less effective, the goal is to maintain quality of life, and there are many ways to do that. Dementia may present challenges, but it doesn't mean giving up on living a fulfilling life. With the right medication, support, and lifestyle choices, you can still find joy in every day. It's a journey, but one that's worth taking with the right tools and a compassionate approach. And remember, early intervention and regular communication with your doctor is essential. Whether you're adjusting medication, exploring therapy options, or making small changes to your lifestyle, you don't have to go through it alone. Stay informed, stay connected, and keep advocating for the best care. Thanks for watching. If you found this video helpful, consider subscribing to stay updated with more practical health tips every week. We'll be here to support you on your journey to living your best.